Thank you so much. Welcome to the webinar, and thanks for the opportunity. Thanks, GS1 UK and Scan4Safety. My name is Deniz. I'm the CEO for the Global Medical Device Nomenclature Agency. Yes, I can control the slides. Thank you. Okay, great. So, today it's a brief introduction to the GMDN. What is GMDN, the use cases, what is the relationship between GMDN and UDI implementation, and how a nomenclature, and especially GMDN, can support global and national public health care programs. And many of you may know, or well, maybe not. I will try to keep it brief, and I will try to answer all of your questions. But if there is not enough time, please just put in the questions in the chat box so we can answer them after the meeting. Okay, so very brief. GMDN is I'm sorry. GMDN is a non-profit charity based in the UK. Its history started back in 1991 when the European Standards Organization, and later supported by the Global Harmonization Task Force, which is now IMDRF, thought that the world needs a nomenclature with a single common understanding. From that day to 2024, agency have come along, and maybe you have already introduced to GMDN at other platforms. So, what do we do? Nomenclature, GMDN, name and group all medical devices, and I'm going to show you a brief example in a minute. There are 25,000 GMDN terms for all medical devices, grouped by categories, arranged in a multi-hierarchical structure. This is very important because when we read something, when we try to define a medical device, that needs to be very clear, and no room for duplication or ambiguity. Access to GMDN is quite easy. You just need to become a member. GMDN within the charitable cause provide free access to all regulators, government departments, healthcare providers, hospitals, national healthcare services. It is a globally recognized and an independent system. More than approximately 13,000 users. 70 different regulatory systems use GMDN in some capacity, and the members, the users, are across the world, more than 145 countries. Great deal of experience with the UDI implementation, especially with the FDA's Good ID launch. GMDN have been a proud partner of FDA since then, and other UDI implementation programs, including in the UK. As we said, it's a self-funded, independent, and guided by regulators. I'm not going to go into detail with this one. I just want to clarify. We always say guided by regulators, and what does that mean? You can see the regulators on the right-hand side are actually making our authorities strategic advisory group. Members from Brazil, Anvisa, US FDA, Health Canada, MHRA, UK, and TGA meet regularly and provide guidance, strategic guidance for GMDN. And also, technical group helps GMDN to tackle with everyday technical questions related to structure. The quality management system is in place, and if you have any questions, we will be happy to answer all about that later. So, okay, about the structure. GMDN is the nomenclature in a multi-hierarchical classification system. There are 25,000 terms grouped by 2,600 categories, arranged in a multi-hierarchical structure. The categories are grouped under different headers like device function, anatomical specialty, but also gives a lot of information in terms of other attributes, like if it's implantable or not implantable, the power, active, non-active, and I will show you an example in a minute. Okay. As we say, the nomenclature comes in two structures. On the right-hand side, the flat listing nomenclature, which term names, definition, and codes, which they define in detail a group of devices. And on the left-hand side, you can see the hierarchical classification, which every category have a name, definition, and code. The right-hand side nomenclature terms to catch up with the innovation in the medical device industry is dynamic. As you can imagine, the categories are more stable, more static as we mean. It's important to recognize the definition is in the heart of the nomenclature of what we do. It's the terms are non-proprietary groups. They're defined by name and definition, which involves intended use, technology, material, form, component, and significant attributes, especially if they're clinically relevant. And there's a code attached to it. Here is an example about, this example I choose because it's from the National Wound Care Program. This is one of the codes that has been used there. This is you can see the term name, term code, and the definition. And this is important because anywhere around the world who have this definition will understand what the device delivers. So how does this relate to the categories? As you can see in a multi-hierarchy, this term belongs to the category at the lowest level, wound non-adhering dressings. And you can dice and slice the data with device function, anatomical specialty, name index. And you can see other attributes if it is assigned to that category. Also, at the lowest level category, there are other devices which belongs to that category. If there is a registry program or in terms of defining the differences between the medical devices here, they can check also the attributes, the definition for these group of devices. GMDN use cases. So it's been more than 25 years that the first edition is published. GMDN enables traceability, single language in terms of information exchange, and enables analysis. So we see the use cases obviously started with the pre-market approval, it's the planning, capturing the innovation within the new devices definitions, which we relate to UDI programs. FDA, MHRA, TGA, ANVISA, Health Canada, INVIMA choose to work with GMDN in terms of their UDI implementation. Obviously, this information is not just staying with the pre-market approval. It travels across the supply chain about purchasing inventory and also, more importantly, safety signal detection. When we look at the use cases, we can give examples in each type of use, starting from, for example, market analysis, cost effectiveness analysis have been performed, especially in the US, because the Good ID is a complete database launched, and then we can see also various medical device manufacturers use GMDN classification system to perform market analysis with their devices and also with their competitors. For the purchasing systems, we can definitely say various NHS and private hospitals in the UK use GMDN database, utilizes. There is also, because it's a global platform that we are providing information for, I can give the example for the Gulf Health Council, GHC, Joint Procurement Portal. It's called Tavun. It's a tendering platform for all the Gulf countries and managed in Saudi Arabia. And they use GMDN as the device descriptor alongside with many attributes and with obviously UDI information. Looking at the safety signal detection, the registries are in the heart of it. US registries where Good ID is referred, used. We can also give examples in terms of UK NHS National Wound Care Project, which I think recently they had a meeting, and I think it is available, the recording on YouTube. We can also give information in terms of Netherlands National Implant Registry, which is going on for a while. Within all these use cases and projects, we do work together and collaborate with GS1 in different countries, in Netherlands, in the UK, and other parts of the world. Sorry. Here is an example in terms of showing briefly the UDI and GMDN relationship. So the unique device identifier, as you can see with the code, manufacturer information and catalog, GMDN complements the UDI. And you can also see the basic UDIs here for a group of devices. But there's a distinct differentiation between what is basic UDI and what is GMDN. So the basic UDI is intended to group all medical devices from a particular manufacturer that share the same features intended to use. GMDN does it in a multi-hierarchical way, but it's a non-proprietary definition. Okay. We talked about the UDI implementation. Beyond the UDI implementation in the UK, in the US, there are other countries working on their UDI implementation and having access to GMDN utilizing. The Europe works with EMDN as a preference in their UDI implementation, but we still see some European countries accessing GMDN and utilizing it, especially in asset management, also registry programs. Here is an example of how actually GMDN is displayed in some of the UDI programs implementations, and how it can help the traceability and speaking the same language between different jurisdictions. There is also other examples in terms of, I don't know if you have heard, there's a program called eStar between Health Canada and US FDA, which they use also GMDN as a common product information in terms of regulatory submissions. So here you can see the infusion pump, bedside infusion pump, single channel. The GMDN code makes it available and traceable in different platforms. And we're very excited also to work with the UK PIM database, and it's going to be a great addition and a great help in terms of device analysis. So, as GMDN, we support global and national public health programs. Traceability, single language, and analysis, enabling analysis is the main features. It is embedded in the regulatory framework. A single common language is important when we're talking about grouping medical devices. Also, what is different from other nomenclatures which are widely available across the world, GMDN represents the current supply of the medical devices and captures innovation. We also said they complement the UDI and traceability across different jurisdictions, early signal detection, beyond the signal device issue detections, and capturing proportional reporting ratio within a group of similar devices, which is quite important. And we also cherish that GMDN helps that linking medical device data across different healthcare stakeholders. It could be at international level, but also national level. So thinking about, for example, at the customs with the World Trade Organization implementation and the discussions about how to define and how to address medical devices at the customs level. Also, nomenclature helps in that too. Obviously, supports global harmonization. Maybe to remind, GMDN also started a new collaboration with the WHO lately. We signed an agreement with them in March, and there was a webinar launching that partnership on the 8th of July. You can also refer to that webinar if you're interested in how GMDN, EMDN, and WHO collaborates together for MEDEVIS publications, priority medical devices list, and also EDL IVDs. And I think that is, sorry, okay. We talk about access to GM at the very beginning. It's so easy. Please reach out to us. On our website, you can register easily, find your membership type if you're from NHS, National Healthcare System, regulator, medical device manufacturer, or conformity assessment body. And please complete the registration form and verify your email, and then you can start using GMDN. There are lots of resources in terms of defining the publicly available resources. Even if you're not a member, you can log into our website and use these training resources, user guide, and also a lot of resources in terms of frequently asked questions.